back to J Chats. It's your girl JD, and we are inside of another very interesting conversation, or as I say, chat. Can't wait to get into your world. Don't forget though, before we continue, please click like, subscribe, and share, and also click that bell so you know every time I drop a new video, alright? Thank you so much for the support. J Chats, from interest to insights. Let's jump into it. Enjoy. Hey guys, welcome to another episode of J Chats. I'm JD. It is good to be inside of your world. Thank you so much for coming onto the platform. And as always, you know what you need to do. Click like, subscribe, and share. So we've had different conversations from different sections of just our existence, whether it's building your marketing skills, finding out how to take care of your natural hair, maybe even working on your makeup. But today, as we observe this month, which is Alzheimer's Awareness Month, I thought it is impossible to not have this conversation, delving into this conversation with this young lady right here. Now, I've been stalking her a little bit on her Instagram page in a good way, but with me, I've got Simone Blackwood. Now, I need to make sure I get the title correct. She's a gerontologist. Did I get it correct, Simone?
Correct.
Nice.
Great job.
So in just a bit, she will tell us exactly what that is. But again, we recognize Alzheimer's Awareness Month. Alzheimer's Awareness Day is on the 22nd. And we are speaking with Simone Blackwood. As her Instagram says, she is a Dementia-Care strategist. So we're going to dive inside of conversations pertaining to that. Dementia-Care professional, trainer, educator, advisor, advocate, and also you can schedule your consultancy appointment with them. We'll find out more about that in just a bit. So Simone, thank you so much for joining me on J Chats. It's nice to finally meet you here.
It is so nice to be here. Thank you so much for having me. Sorry if I'm moving around a bit.
No problem.
I just want to settle in and make sure I'm comfortable to speak to you guys.
No problem. Thank you so much for giving us some time.
No
So this terminology, gerontologist, let's start right there. What is a gerontologist? Of course, that's who you are. Well, what exactly is that?
I'm smiling because I think I answered this question 3 times today. This will be the 3rd time today that I'm actually answering this. Yeah, I'm answering this question. So every time someone asks me, I giggle a bit. But when we speak about gerontology, we speak about the study of aging, right, and we look at it from different perspectives. We look at aging on a societal level, and we also look at aging at an individual level. Hence my job description, where me working one-on-one with families and working one-on-one with an individual who would be suffering from dementia, right? But we also look at the biological aspects of aging. We look at aging from the sociological aspects, from public health aspects, economy, and all of those different things. So if I had to break down what I do, I simply would say I would work one-on-one with families, looking at all those aspects and putting on the forefront ways persons can age healthy, and when in that process, enhancing their quality of life. So that can simplify what I do.
In your years of doing this, do you realize that there's a big need for persons like yourselves? And I know it sounds like a strange question, but is it because we've been getting it wrong with caring for the elderly or the aged?
There is a need, and I'll tell you why. Aging matters to everyone, not only from a professional perspective, because I don't think everybody would want to be a gerontologist. It's really not glamorous, but on a personal level, it is something that is important to everyone. We age daily. I always say from the time we were born, we age.
Yes.
Nobody is never a day young. We're always a day old. And within that, even if the person, it could be a young adult as myself or yourself or the listeners, it could be something simple as look at my parents or look at my grandparents because they are aging, and you would want to know, you would want the best care for them. You would want to know what you can do to help them on their aging journey and make them as comfortable as possible. So it is something that is needed. And I'm happy to always bring awareness to the forefront because persons are not aware. A lot of persons before were not aware that this is something that exists. So I know that there is a need for it because we are an aging society. It is all around us, and we have to tackle the issues head on.
As you said, we're all aging since we've been lucky enough to be born, and some of us are still here and we age daily. But also, you just spoke about, many of us will have elderlies within our families, and this is, I guess, a personal sort of project for me because my grandmother just turned 87, and thankfully she's still very much active, she's coherent and everything. But of course, you now, meaning me or those that are younger than her, have to apply some sort of patience and understanding because things are different now as they get older. Yeah?
Correct.
So I
Correct.
certainly really think this is sort of the conversation to have, or you're the person that certainly we need to know more about that can guide us and help us to gain some patience, yeah, and some understanding, yeah, because sometimes we still think that they're very much the same that they were before, and obviously in some cases they're not. But being inside of this month, Alzheimer's Awareness Month, one of the questions that I placed earlier on in this week to Dr. Sante LeBlanc, who went into the clinical side of Alzheimer's, I want to also put the question to you too. Can you just give us, in your, as an expert in this field, what exactly is dementia and how different is it from Alzheimer's? I've got the answer earlier on, but I still know we may have different listeners or visitors to the site today. So can you just delve into that?
Sure. So I'll give you a breakdown in the simplest layman terms to answer your first question, the difference between dementia and Alzheimer's. Now, dementia is a group of symptoms, yes? And so we coin it as an umbrella term. Alzheimer's is a type of dementia, right? And we would have different types of dementia. While there are base or main clinical manifestations of what dementia is. So it's accompanied by memory loss, hallucinations, a breakdown in cognitive skills, a breaking down in motor skills. And so those are the main clinical manifestations of what dementia is. And because Alzheimer's fall under that umbrella of dementia, you would find some of those clinical manifestations under an Alzheimer's diagnosis, right? Now, we use clinical manifestations to get a diagnosis, which I hope the doctor before would have said that Alzheimer's diagnosis are usually diagnosed after death.
She did
right?
say that.
Yes, so we can't get a diagnosis while someone is alive. However, using the early signs, the 10 early signs of Alzheimer's, which is the memory loss and difficulty completing familiar tasks.
Yes.
These are the manifestations that we would use, and given the fact that the person was, let's say, normal, yeah, we would use that as a guideline to ascertain, okay, perhaps something is happening and perhaps it could be Alzheimer's. I really hope I made that differentiation, as simple as I can. I try not to use the bigger words.
Terminologies, yes, understood. Yeah. I appreciate that.
Yeah. So we use the clinical manifestations from dementia, and some of the signs would be for persons who are suffering with Alzheimer's, and that is what we would use to ascertain a query diagnosis for Alzheimer's patients.
Before we go any further, I'm looking at you and I'm looking at the youth in you, and you said just a few minutes ago that, it's not a passion project, it's not like glamorous, but what really was it that pushed you into doing this, wanting to give your time and your knowledge and your care to dealing with the elderly?
It's a pretty long story, and let me shorten it because we only have a few minutes. My background is in nursing. I started my nursing degree at COSTAT, of course, and within that we have gerontology as part of our project, one of our courses to do. And we also have to do our practical. And within doing my practical, I would have experienced or worked with older persons who came on the wards as patients. What I would have noticed is that they didn't teach us much about dementia and Alzheimer's. It was just the basics. And so when I was confronted on the ward, working with an aged person who had signs of dementia, of course I didn't know then, but I know now,
Right.
who had signs of dementia, I noticed I was not equipped to deal with this. And many of my colleagues as well were not equipped to deal with it. And so we would use restraints. We didn't know how to communicate with the person. We were just of the impression that, hey, this person is old and they're just old and they're giving trouble.
Miserable.
Yeah?
Yes.
They're just giving a little trouble. They're just miserable. And, they live their life and they have that right, as we see sometimes.
Yes.
They have the right to give trouble because they live their life, not knowing that there was something really happening there underlying. And that caused me to dig deeper into what exactly happens with the aging process. So then, of course, in Trinidad, we don't have any gerontology programs. And so I had to go further and get a program in gerontology, which helps me to understand what's happening. And now I have the ability to help families understand what's happening and try to, get rid of the myths that the person is older and so they're supposed to give trouble, they're supposed to lose their memory, they're supposed to be depressed and all of that. So I think I have my work cut out for me.
How many are there like you in Trinidad and Tobago, by the way?
I know of one person, Dr. Jennifer Rouse. She was the former division of aging.
She's amazing.
Hi, Dr. Rouse. I know of her. I would have spoken to her a while back. I'm not sure if she remembered me, but she was really, vocal in putting different policies and stuff for aged persons. Yeah. And she was really forthcoming with information, helping me with some statistics and all of that. So I know of her. I know one other person, but the name is just not coming to mind right now. And those are the only two persons that I can say that I definitely know of that works within the public sector in terms of aging and still behind the scenes work and try to get aging issues on the front line.
So before we wrap up later on, I do want you to talk to persons who may want to come into that field, because you just said it's a small pool really, but there are a large number of elderlies on the outside. In terms of Alzheimer's themselves, the numbers may speak for themselves in Trinidad and Tobago too. So we need more of you, and I know there's only so much you can do. So I know there are persons who would certainly like to find out how they can go about that. Maybe you can share that later on in our discussion. Yeah? Sure. So Simone, earlier, as I mentioned before, I spoke to Dr. Santi LeBlanc on the clinical side, but today I want to dive in the conversation with you on the caregiving side to speak to those caregivers, whether it's by profession or maybe just a loved one who is now taking up that role to care for someone who has dementia, right?
Okay.
So if we can start.
I'm so happy that you brought up that without, I'm so sorry to cut you, but I was so happy that you brought it up because I made a post, I think it was last week or week before, trying to explain what a caregiver is. Now, I know in the culture that we are in, we would think that caregivers are the geriatric nurses that come in and take care of our aged persons in our absence. Right. But I want to put it out there on this platform and to everybody that's listening. If you have an aged person at home that is relying on you to make decisions regarding their care, you are a caregiver. So it matters not what your profession is. If you are a medical doctor, you are a psychologist, you are a photographer, whatever you are, once you have an aged person in your care that relies on you to make decisions, you are a caregiver. You would be a family caregiver and not so much a professional caregiver because you were not trained, but you still are a caregiver because you have to provide care for that person. You have to make sure that doctor appointments are met. You have to make sure medication is managed. You have to make sure nutrition is managed. You have to provide financial assistance for caregiving services or whatnot. And so you are a caregiver. So I just really wanted to say
I'm glad you said that. I'm glad you said that. So can you speak to us caregivers, because many of us are sitting in that role? What are some of the do's and don'ts, especially in targeting just the elderly, but again, we're looking at Alzheimer's or dementia. And I know that's really your specialty point right there too.
Yeah. So the thing is, it's a fluid situation when you are a caregiver. A lot of people think that, it could be a one size fits all thing, but it really isn't, simply because older persons are a diverse group of people. So no older person is the same. Personalities will differ, and so you need a different type of personality to deal or to work along with the aged person. You need a lot of patience. Understanding that, listen, we are not, there is an intergenerational gap there.
Yeah.
And as I was saying this morning, that's a gap that we need to try to bridge within the Caribbean, right? There's an intergenerational gap. And so we don't speak the same language as our aged persons. We do not have the same conversations. The context of conversation would be different. And so the very first thing you need to do if you're trying to engage a person is try to get their context of conversation.
Right.
Speak about things that they would be interested to
Right.
them and that you can be interested in as well, right? I mean, not every conversation they speak about is boring. There are a lot of aged persons that are in tune with what is going on right now. I would say intelligent conversations, because not all aged persons are senile and don't know what they're speaking about. So if you want to engage somebody, you have to look at the context of the conversation first, because with the intergenerational gap comes that communication barrier. And it's a hurdle that we have to cross if we want to meet the aged person, and if we want to engage with them, if we want to have a good relationship with them, a happy relationship, I would say, we would want to cross that barrier. Secondly, besides communication, we have to exhibit a lot of patience, because, as I said, we don't speak the same language. Body language is something that we, Caribbean, we do a lot of nonverbal communication, right?
Yeah.
And that is by gestures, it's by facial expression, and it's body language. And you see our face tells a lot, especially when we're dealing with dementia patients. Our facial expression tells a lot. And so when you're having that, when you're trying to break the communication barrier, you have to be mindful of how you present yourself to them with your body language and with your facial expression.
Wow.
While some patients who have dementia can or will experience aphasia, which is difficulty speaking, sometimes they also have difficulty recognizing face.
Yes.
But they do not have difficulty recognizing emotions. So I hope that makes sense.
Yes, it
Because
does.
somebody might say, how come you can recognize face, but we recognize emotions? We recognize a smile, we recognize a frown, we recognize when somebody's upset. These are things that we see all the time, right? And so that aged person also will recognize it. And of course, their mood can turn according to what your mood looks like to them. Yeah?
So if you
So
come there all frustrated and just annoyed, obviously you're not going to get good feedback from them as well, because you're trying to
of
keep
course
them.
not.
Yeah.
It will be most difficult. It
Yeah.
will be most difficult because, one, you are going to them with an attitude and they will sense it. And let's take a person with dementia, for example. Now, they may not be able to express their feelings. However, they can see you look like you're frustrated. You look like you're annoyed. And they do not have the mental capacity to think, okay, maybe it doesn't have anything to do with me. They can think maybe it has everything to do with me. And so that person in turn will become frustrated as well. So
Yeah.
when we're working with, and I like to say working with, as a caregiver, we work with the patient, and we have to stay in their moment, right? In their moment means that sometimes they tend to forget, sometimes they will say things that doesn't make sense to us, sometimes they will say things that we would think, well, what is this person babbling about? But you need to stay in their moment.
Yeah.
You stay in the person's moment and you meet them where they are. So if they're speaking something that doesn't make any sense, you ever heard the term madness is gladness?
Yes.
You engage them in the conversation, although it makes no sense.
Because
They
you're
are
in the
looking.
moments. You are, yeah.
We live in the moment, and then remember, a lot of persons with dementia will have short-term memory. So it
Yeah.
means that they would say something in the moment, and then of course 5-10 minutes later they don't remember what they're saying. But the key is to meet them and engage with them in the moment. In the moment. Yeah.
Yeah. Those are very important points that some of us may have not even thought about or forgotten about. Just again, because I love where you're driving to the point that patience is it at the end of the day. So
Mm-hmm.
for one adopting, whether it's on the professional side or just knowing that you have agreed, I am going to take care of granny or mommy who's going through this process, or daddy, you have to know the basis of that. You will have to apply some serious patience,
Of course, of
and
course.
understanding.
And the thing is, what that patience, what I've felt that if you have that level of understanding and proper open channels of communicating,
Hmm.
usually you don't have issues with the patient. Now, why I would say that, because one of the issues that a lot of people have with dementia patients is the challenging behavior. Yeah, so the three A's in dementia: anger, aggression, and anxiety.
Hmm.
And that is why I believe in using a behavioral approach, because all of these issues are actually behavioral issues in dementia patients. And because of those challenging issues, we have a communication barrier. Hence, I always stress on overcoming the communication barriers if we want to get any headway with aged persons, whether they have dementia, Alzheimer's, or not.
Or not.
Once we have to make headway in having a smooth relationship with an aged person, we
Mhm.
have to overcome the communication barriers.
What I'm looking at your page here, and just such a wealth of knowledge, guys. So check out her Instagram page, Simone Blackwood. Right, that's simply the name I'm seeing there. But what are some of the hardest things about being a dementia caregiver? You have a particular post in relation to that. Can you speak to that? Just a few of those things that
Sure.
make it the hardest as a
Sure.
caregiver.
It would be, as a caregiver, from a caregiver's perspective, if you are a sibling providing sole care, it is very difficult without the support, because of course you would have your own family. There is a post where I would have made reference to what we call the sandwich generation, and the
Uh-huh.
sandwich generation is persons like you and I that have our own families and still are caring for our aged
Yeah,
parents. So
yeah,
we're stuck in the middle, hence the term sandwich,
general,
right?
right.
And one of the most difficult things about that is you are torn into two or sometimes three,
Mhm.
because you have to be a wife, you have to be a mother if you have children, and you also have to be that caregiver for your aged parents. Then we look at the burden. There is a stress burden attached to that, because you have the stresses of your own family and you have the
Yes.
stresses of parents. Yeah. And then we have a financial burden, because if your loved one, if your parent is relying on pension, of course, we know how much the pension is and we know how far that can reach. So now you have to also provide for your aged parents.
So the
If that
caregivers need caring for as well.
caring for caregivers, hence the reason my podcast is called Caring for Caregivers. It was strategically named that way because I realized early in the game when I started my studies in gerontology that, listen, caregivers get the
Yeah.
they get they get the shitty, excuse my language, end of the stick.
Thank you. This is
You
a
know?
platform we can say that. Yeah.
Yes, they get the shitty end of the stick, because they have to split themselves into so many persons that they neglect themselves. And it's difficult because you have a lot of different feelings and emotions that will accompany the caregiver. You are now feeling guilty. Do I choose to not visit my mother this weekend and stay home by myself because I just need peace and quiet? Do I fight it and go there even if I don't want to go there, because you don't want anybody to say, look how she's neglecting her parents? Then you are studying, should I put my mother or father in a nursing home?
Yeah.
What would the people around me say? They would say, look, she can't even take care of her family. Look how she just throw the woman in a nursing home. So we have issues coming at caregivers at every angle. right? Every single angle. So caregivers need retreats, caregivers need support,
Yeah.
caregivers need family support. I know of families that would have siblings of 5 and 6 persons, but only one person is doing
It's
everything. And it is hard. It is hard. It is difficult. So they need the support. I'm making a public appeal. If you have an aged person and you're not pulling your weight, you're not doing what you're supposed to do, and you have a sibling that's doing it, help out. A little help will go a long way because
and,
it is difficult.
and like you said, you don't want to pass on that as a caregiver, that frustration on the elderly, the person you're taking care of, because you yourself saying, I have to do this all by myself, and you may have 4 or 5 siblings. So it is unfair, understandably so, for you to do this on your own. But other siblings need to pay attention to that fact that you may now mirror this onto the elderly because you're frustrated, you're exhausted, you've reached your
Correct.
point.
I
You know,
like that point because I'll tell you why. There are a lot of aged persons who are fiercely independent and they don't like to ask for help. So when you have a sibling and you are not pulling your weight, it means that your loved one is suffering because they may want something and they're not going to ask you for it because they may see the frustration, they may see the tiredness, they may see the constraints, and most times they don't want to project their stressors onto you. And so that aged person can suffer in silence because
and
they don't want to put the added stress. Yeah.
Simone, you're saying some things that are touching a nerve. My grandmother, thankfully, is she's getting older. She may forget here and there, but we're not seeing any signs of that. But I just think about it in a general sense where we have conversations, and I'd say, "Do you need anything?" She's old. They never need anything.
They never need anything.
Never need anything. And I know sometimes I sound like a recurring guest. Well, every time to talk to her, I said, Miss Sheila,
They're like a broken record.
yes, you good? You need anything? She's like, yeah, I'm good. But I remember once she had a mini stroke about 3 years ago. And of course, we all were all on her, taking care of her and doing everything. And one of the things that stuck with me is when she said, I don't want to be a burden to anybody. And from
Yeah.
there, I said, you know what? I know that's maybe why she's thinking the way she is. She's always good. But I want to
Good.
really get to the
Exactly.
point. You can always ask me, tell me what you need. I'll go get it. I'll get it. I'll get it. And we have to show them how supportive we really are.
We are. That's it. And again, I'm happy that you brought that point across because sometimes they will say it, sometimes they wouldn't say it, but as the caregiver, you need to know, listen, they may need something, but they just wouldn't say. And so once you have that close, you have to develop a close relationship with them, and thereby, okay, grandma may need certain things or mom may need certain things. And so you can take it on your own accord and just bring it to them rather than having them ask you for stuff. Because remember, they don't want to ask. They don't want to.
Because they're so independent on their own.
Yeah, because they're independent. They want to do things on their own. But the issue is because they're so independent, they may be suffering in silence. And so we have to step up to the plate, develop that relationship with them, that trusting relationship, hoping that, okay, I will trust her to tell me she needs something. But on the other hand, in the back of your mind, okay, she may not see anything because she doesn't want to be a burden, but let me just go across, have a conversation, look around the house, see if she has to get anything. Maybe the yard needs cutting. She probably may need medication if she's taking medication. Probably she needs some food, she needs some veggies, or she just needs company. Take it upon your own.
That's another point, company.
Yeah, sometimes they just need a company because a lot of aged persons right now suffer with loneliness and it sends them into a stage of depression. And this is the domino effect. When we are isolated from them, they suffer from depression and they go further into it. And then we are thinking in the back of our minds, well, hey, she's just depressed that because she's getting older. When that's not the case, you see. So the dynamics of aged care has to change. It has to start with the caregivers, but there needs to be a balance. There needs to be a balance between you and your limitations or what you can do. You need to balance what you can and cannot do.
there's that word. If Dr. Santi LeBlanc hears you, she loves that word balance, because she always, it's so important to reinforce that point about having that balance. And I absolutely love all the content you're sharing today. And I just want to encourage persons who are looking on to share this as well, because you just never know who's going to be impacted by it. Now, Simone, I know you're extremely busy, so you've got some other appointments. I just quickly wanted to also tell us, because looking at your Instagram page, one of the platforms that you have, you share a wealth of knowledge. So you've got a lot of info to distribute to the various persons, be it caregivers, be it professionals who need to know certain things as a gerontologist. Yes. Can you just direct us to some of your pages and tell us exactly what we need to do to communicate with you on some of these topics?
I'm sure. I am on Instagram, Simone Blackwood TT. I am on Facebook, Simone Blackwood TT as well. Twitter and LinkedIn, I have the same name, so it will be easier for me to find. And you can send me an email. You can use the scheduler button in my Instagram or on my Facebook page, and you can send me a direct email requesting a consult or just to have a conversation if you're not sure on what's happening. I just want to say here, use this opportunity. If you notice any changes with your aged person, to bring it to the attention of a professional. Mm-hmm. If you notice that they are forgetting things, if you notice that it's not business as usual, where the person is they are no longer able to have certain conversations with you, whereas they could have been, before. Right. If you notice what we call MCI, mild cognitive impairments. Right. Sometimes it could be serious, sometimes it's not, but bring it to the attention of a professional and seek early intervention. Yeah?
Yeah. Tell us about your podcast too, because I certainly like to check that out as well.
Oh yes, well, my podcast is called The Caregivers Lounge, and it's a Caregivers Lounge, and within the episodes, some of the episodes will be called Caring for Caregivers. Right. So some of the episodes will be geared towards caregivers and the challenges that they face and ways that they can overcome the challenges, cross the hurdles of caregiving. And I speak a lot about having a guilt-free journey, because that's one of the things that caregivers suffer with a lot. They suffer in silence, they are guilty, and I want to encourage persons to speak on the platform and come out, because you are not alone on the journey. So the lounge aspect of it is somewhere where caregivers can go, they can relax and get a wealth of information for free. Right. For free, where I would bring on different persons who would have either cared for someone with dementia, a specialist that would specialize with different aspects of the clinical manifestations of dementia. I try to bring in persons that are relevant to the caring of dementia, because gerontology is multifaceted, right? As I said before, it takes in a lot of different roles, so sociological roles, emotional roles, psychological roles, all of those things. And so my aim on those podcasts is to address every single role and need of the aged person and need of the caregiver, and to be as a resource, to share resources with them. That is my ultimate goal.
And I see you doing it so well. I just want to say congratulations to you, because, as a young person, you are certainly dividing your time, of course, taking care of your own family, but also sharing this knowledge with many others who have to care for their family. And, I really appreciate your input and what you've been doing. I really wish you all the best. I'll certainly be checking out your platform. And I love your Instagram page. It is packed with stuff, so guys, check it out. So thank you so much, Simone Blackwood. You are a gerontologist. I wanted to say it again to make sure I get it correctly, and I think I did. So
you did. You're doing fantastic.
Thank you so much for your time coming on to J Chats. Yes, and
thank you so much for having me. Thank you. Bye. Bye to everyone.
Thank you so much, guys, for looking on to J Chats. I'm JD. See you inside the next episode. I tell you, you never know. So click like, subscribe, and share. I'm Jay. Take care. God bless.